we see acute kidney injury, many medical students and junior doctors are taught in a simple rule. If you see AKI, you give fluids. In many cases, this is a correct first step, but in real clinical practice, fluids sometimes help and sometimes make kidney function worse. To understand why, we need to step back and understand one simple principle about filtration. Before we talk about specific cases, let me explain the core mechanism using a simple image. This is how I explain to residents. Imagine two rooms separated by a mover board. The left room represents arterial pressure and the force pushing blood into the kidney. The right room represents venous pressure, the force resisting blood leaving the kidney. The board in the middle represents the pressure balance across the glomerulus. Now imagine the kidney filtration depends on how much space exists on the left side. Now imagine that kidney filtration depends on how much space exists on the left side. So think of the left side surface area as the kidney's effective filtration area. This is not a perfect schematic model, but it helps us understand what happens clinically. Under normal conditions, arterial pressure is higher than venous pressure. The board is pushed slightly to the right. That means the left side has enough effective area, and filtration occurs normally. Here is a key idea. Filtration falls whenever the board moves to the left side. When the board shifts left, the effective filtration area on the left side becomes smaller. Less effective area means less filtration. So in this model, board to the left equals GFR down. So in this model, and what makes the board move to the left? There are only two mechanisms. First, the pushing force from the left becomes weaker. Second, the resistant force from the right becomes stronger. No matter the cause, if the board moves to the left, filtration falls. This simple idea explains most cases of AKI. With this image in mind, let's look at two common patterns of AKI. First, dehydration. In dehydration, both the arterial side and the venous side lack volume. In our image, this means that both rooms become smaller. Because both sides are underfilled, the left side area is reduced. As a result, the effective filtration area on the left side becomes smaller. And when that area shrinks, glomerular filtration falls. Now let's consider what happens when we give fluids in this situation. By correcting dehydration, we refill both rooms, arterial pressure improves, venous pressure returns to an appropriate level. As pressure balance is restored, the board moves back towards its normal position. The effective filtration area increases and glomerular filtration improves. This is why in dehydration-related AKI, fluid resuscitation works. Now let's look at a very different situation, congestion. In congestion, the problem is not lack of volume. Instead, the venous side is already overfilled. In our image, the right room is already large and pressurized. Because venous pressure is high, the board is already pushed to the left, and the effective filtration area is reduced, so GFR is low, even before any treatment begins. Now consider what happens when we give fluids in this situation. The arterial side is often already adequate. However, the venous system has much higher compliance, so when fluids are given, they do not significantly increase arterial pressure. Instead, they preferentially flow into the venous side. As a result, venous pressure rises even further. The body is pushed even more to the left. The effective filtration area shrinks further and glomerular filtration falls even more. This is why in congestion-related AKI, fluids can worsen kidney function. Now here is an important point that often feels counterintuitive. In congestion-related AKI, removing fluid can improve filtration. Let's go back to the box model. When we give diuretics, we remove volume primarily from the venous side. As venous pressure falls, the right room becomes smaller. The resisting force decreases. As a result, the board can move back to the right. When the board shifts right, the effective filtration area on the left side increases, and when that area increases, glomerular filtration improves. So even though we are removing fluid, kidney function can recover. This is why in selected patients with congestion-related AKI, diuretics do not harm the kidney. Instead, they restore pressure balance and improve filtration. So how should we think clinically? The key principle is simple. Fluids are not a treatment. They are a diagnostic tool. When we give fluids, we are testing whether the filtration area improves or not. If it does, filtration improves. But if fluid only increases venous pressure, the body moves to the left and filtration worsens. Let's summarize the key takeaways. In AKI, filtration depends on pressure balance, not volume alone. Dehydration makes both sides underfilled, and fluids restore balance. Congestion overfills the venous side, and fluids worsen imbalance. Relieving congestion allows the body to move right and filtration to improve. Thinking this way turns AKI from a confusion diagnosis into a logical problem. Stay calm, think physiologically, and manage AKI step by step. See you in the next video.